canal treatment normally takes several visits. The first visit will remove the dead nerve or the damaged nerve. It just involves using some little files through a little access hole at the top of your tooth, and we'll get the dead and damaged nerve out, and then we'll replace it with a dressing of antibiotics, anti-inflammatory paste, which will then settle the tooth down, take away your pain, and get the tooth to a position where we'll be able to fill the tooth next time. At that second appointment, we'll clean out the antibiotic paste, check to see that everything's ready to go, that it's healed well, that our canals are well cleaned, and if they are, we'll fill them with a rubbery compound that will be able to fill around the corners of the canals, seal it up so nothing can get back in there. Often then we'll have another appointment to fill the top of the tooth, and this is just as important, and this will keep bacteria from getting in and trying to get around where we've done the root canal treatment. This may involve just a normal filling to fill up the access holes. Sometimes on a bigger tooth you're better to put, say, a crown on the tooth to protect it and stop it splitting further down the track. Unfortunately, that's one of the problems with root canal treatment, is the tooth becomes a bit more brittle, because the part of the tooth you've removed, the nerve, is not just a nerve but a blood supply, and when the tooth no longer has its blood supply, it loses a little bit of flexibility and becomes a bit brittle. So often your dentist will say you should probably put a crown on that tooth to protect it. During root canal treatment, we'll quite often take a few x-rays to measure how the treatment's going, to check that our lengths are correct, that we're removing all of the nerve, not too long beyond the end of the tooth and not too short, leaving some nerve in there. We have other equipment now, apex locators and electronic equipment, that helps us with this greatly, and that's one of the big improvements in root canal treatment over the previous few years. We also have new rotary files which clean the root canal system out much more thoroughly than we used to be able to do by hand.